It's Monday morning. You know, a lot of the time we focus on women in this segment, but today it is all about the guys and specifically the rise in cosmetic procedures among men. Allison is finding out a little more with a special guest. Hi, Allison.
Oh, hey, Mel. I am joined right now by Dr. Terrence Keaney, board-certified dermatologist and a member of the American Society for Dermatologic Surgery. And please, and you're also from the...
Washington Institute of Dermatologic Laser Surgery.
Okay, right here. So if you like what you see, you know who to call. So you're seeing more and more men come into the practice.
Absolutely, and there's really two reasons. Number one is men are just becoming more educated about the available minimally invasive cosmetic procedures. And number two, there's a segment of men that are what I like to call more cosmetically conscious. Those are younger millennial men. They grew up in the era of social media, with photos and videos. They've become more conscious of their appearance, whether that's working out, buying clothes, and getting cosmetic procedures or taking care of their skin.
Okay, so what we're going to see before and afters, are these considered then minimally, are they invasive at all? Are they injections? What are we saying?
So there's two series of photos. The first is an injection, just a simple Botox treatment in the upper brow of a younger patient. And the second photo is more of an invasive procedure for hair loss, which is the #1 cosmetic concern that we see with men.
Okay, so this then is the wrinkles, and tell us what we're seeing here, Doctor.
So this is dynamic wrinkles. So the male is lifting his eyebrows, and you can see those lines are being created. Now, over time, those lines will stay even when you're not using those muscles.
My goodness.
Yeah, and so this is just a simple injection, softening those the muscle that's creating those lines, giving a nice natural look. He's still able to raise his eyebrows, but he's very pleased. And this is interesting because this is a male patient who was referred by his girlfriend, didn't understand what went involved in this procedure, but was extremely happy afterwards.
Okay, that's pretty dramatic. What do you remember the age of that person?
He's around 32 years old.
Okay, okay. And doing it earlier, does that help?
Yeah. Yes, well, particularly with Botox, because Botox, all it works on is the muscles.
Okay.
And those muscles over time reinforce those lines to the point where those lines stay even when the muscles are not being used.
Muscle memory.
Exactly. Well, so if you soften the muscles at an earlier age before those lines are etched into the skin, you can prevent them from even forming.
Love it. Okay, go back to the before, please. I'm sorry, I'm talking too much. We're talking about another issue that men complain about often, hair loss.
Yes. So the #1 cosmetic concern with men is hair loss. And partly because men, you know, their cosmetic concern is aging. Women are a little bit more particular. You know, I don't like this spot, this line. Men just overall want to age more slowly. And hair loss is the #1 concern.
Hi, Tucker. Tucker doesn't have this concern, so he walks in freely.
So this is a gentleman in his late 30s, early 40s with male pattern hair loss or baldness. And surgical procedures, surgical hair restoration has been around for a long time, and it's evolved from the old hair plugs to a very discreet, subtle, natural look.
So we can go to the after. I want to know what you did.
Wow.
That's amazing.
So this is robotic hair restoration. So traditionally, to move hairs, the idea of surgical hair restoration is to move hairs from the back of the scalp, where men don't lose it, to areas of thinning. They used to cut out, or they still do, we still cut out a strip of skin to dissect each individual hair to move them.
Wow.
But this robot was developed to avoid that linear scar, that big surgical procedure. The robot actually perfectly dissects out the hair in the back of the scalp, and then we place the hairs in the areas of thinning. The idea is there's no linear scar, so no visible scars in the back of the scalp.
I have seen it go wrong with the scar in the back.
Exactly. So you would see
it was on that show called Botched.
That's pretty advanced.
So, Tucker, do you have any questions?
Yeah, I just was going to ask where do we start with this phase? I'm afraid I'm too far along with the, you know.
So, do you really want Dr. Keaney to answer that question?
No, not really.
Okay.
I want to look like that. So, I mean, what can you do? Like, so, okay, so how about for under your eyes?
So under your eyes, the reason the under eyelid, the eyelids become more prominent is twofold. #1 is our mid-face, our cheeks. With time, we lose volume, as we say.
We get the jowly look.
Yeah, well, it's partly because when we're younger, we have that nice, full cheeks, that heart shape. And then with time, we become more square because we're losing the subcutaneous fat, and we get some bony reabsorption. So we become more hollow in the cheeks. The skin moves down, so we get the jowls. But when the skin moves down, it makes the lower eyelids more prominent. Men and women.
So you're saying then that if the face starts to sag, it drags down on the eyes and it makes it more prominent, the bags there?
Well, it's called shadowing, so it's an effect. So when you have more sharp transitions from certain areas of the face. There's more shadowing. There's more, there's more show of that area.
Okay.
So when you're losing volume in the mid face, the lower eyelids, but also the lower eyelids become weaker. And
so the secret is just to stay young, I guess.
Is that the secret, Dr. Keaney? Or to come
stay
and see
young
you, right?
And start early. Start coming in and adopting a skincare at a young age, wearing sunscreen. There's very subtle, non-invasive ways to slow the aging process. We can't, Father Time always wins. We can't win in that regard, but we can slow the clock.
What
Dr.
percentage?
Keaney is 72 years old. So.
He looks great. Right. What percentage of your clients are men? I'm curious.
45% of my,
wow.
my interest. We've created at our practice a dedicated men's cosmetic center. We call it W for Men. It's a separate clinic space just for male patients. We have all male staff. To make men feel more comfortable, because part of there still is a lingering social taboo for men to care about their appearance, and so we want to make an environment where they're comfortable to talk about their concerns.
Got to let you go. This has been fascinating.
Yeah,
thank you so much. Dr. Terrence Keaney is a dermatologist, and we're going to link this to our website, myfoxdc.com, so you can know how to get in touch with Dr. Keaney or one of his colleagues.